For 100 years, St. Mary's Hospital created a space for monumental changes in healthcare. And throughout that time, what set St. Mary's apart was a mission-driven approach to patient care.
You cannot define St. Mary's by the bricks and mortar. You have to define it by the people, both the people who are part of St. Mary's today in 2012, but also all of those people who've been here since 1912.
At the beginning of the 20th century, Madison was a filthy and deadly city. People did not live long. Streets were filthy, largely unpaved. It was typical of urban areas in America.
Disease was rampant, and hospitals were a place to quarantine the contagious and house the dying. No one thought of hospitals as a place of healing. Catholic nuns had previously established two very small, what were called house hospitals.
After the second sisters-run house hospital failed, the rector was given the unenviable job of creating a replacement hospital. And so the big questions were, what kind of hospitals do we build? Where do we build them? And who will pay for them? He asked 18 orders of sisters to create the hospital, but 18 turned him down. The 19th said yes. And they were the Sisters of St. Mary in St. Louis, Missouri. They had a vision of what kind of hospital that they could create. It would be a general hospital, and it would serve all of the people of South Central Wisconsin. That was a big and bold vision.
This dedicated group of nuns reached out.
They went to the community, said, we need $25,000 from the community. We'll supply $75,000.
Jean Barron's great-grandfather was secretary of the fundraising committee.
And then there was this massive community response to raise the money that was necessary for the hospital.
Pledge by pledge, the money came in.
They came through. They raised the money so that the hospital could be built. The sisters then staffed the hospital. It was something the community needed. It was something that would benefit everyone in the community.
Plans were drawn up for a very modern hospital, launching a new era of medical care in Madison. Inspired by our founding religious sisters, we are guided by the core values of respect, community, stewardship, excellence, and compassion. Stories of great passion and commitment grace our history. Perhaps none is more poignant than that of Sister Mary Fortunata.
Sister Mary Fortunata, known as the Angel of St. Mary's, is one of our great inspirations.
During World War I, a flu pandemic swept the world and millions died. In Madison, hospitals filled to capacity. At the University Armory, stricken soldiers lay with no one to care for them. Sister Fortunata convinced St. Mary's to take them in, and the young nun watched over them day and night.
Sister Fortunata made it her mission to nurse her soldier boys, as she called them, back to health. In a cruel twist of fate, she herself succumbed to the flu and died.
Sister Fortunata's selfless giving is echoed throughout the hospital's history. As times change, the stories take new forms, but the core of compassion remains.
Part of our heritage is a philosophy coming out of Catholic social teachings that call us to be sensitive to those who are poor or disadvantaged or who need additional support.
It's interesting, as you look at the roster of St. Mary's Hospital, the very first patients that they accepted, there was a little notation in one of the columns that read, "Our dear Lord." And what that meant was, these were people who were too poor to pay.
Care was provided for them, regardless of their ability to pay. And I would add that that continues to this day.
If you think about our charity care, and how it's increased over the years. Between 2009 and 2010, our charity care almost doubled. It went from just over $7 million to just under $14 million, and it stayed there in 2011.
Struggling families can find a sudden illness too much to bear. Such was the case with the Schmelzer family when their son needed emergency surgery.
His appendix was inflamed.
It's just frustrating when you know your son is in a lot of pain and he's in the emergency room and they have surgery. It was just, how are we going to pay for this? Because we've been just struggling the last year.
I was just hoping that they could discount it some for us.
When they sent a letter back saying that we're dismissing the charges.
Saw some little writing towards the bottom, and it said something to the effect, "You owe nothing, we've taken care of it." And I called Paul and cried, and it was just a weight lifted off of us.
I have some beautiful flowers for you.
Care from the heart. It makes all the difference for St. Mary's patients and their families. And compassionate service also comes from our many dedicated volunteers and auxiliary who give selflessly of their time and talents. They excel in bringing added comfort in times of need, and they are creative and enthusiastic in raising money to make our hospital a better place for everyone. Started by the nuns, St. Mary's School of Nursing graduated 1,491 nurses. The school developed a stellar reputation, drawing upon the Catholic sisters' long history of charity work as nurses.
When the hospital boom started, the Catholics were the only experienced nurses to come in and start their nursing programs because they knew what had to be done. And it wasn't any theory for any of them. It was just how you should behave on the wards and what you should do for patients.
The sisters provided very professional training and also something more intangible and just as important.
What we saw was a level of commitment by the sisters that sort of got inside of us, and probably without even knowing. The sisters didn't go home to a family. You know, their family was the hospital. I think by their example, we were able to see that they really had this care and concern that was genuine.
That care and respect for all is evident in our interactions as well as the variety of programs we provide.
This one, well, yeah, because our bodies are so complicated. You know that.
For example, St. Mary's Adult Day Health Center. It's the only respite center of its kind in the city. The center provides day-long care for adults with special health needs who can't stay home alone. It's solace for their family and a place of connection and community. Doing all we can to help spirits soar is another way we respect those in our care. Dreams Take Flight is such a program. The idea is to help St. Mary's Care Center residents make their dreams come true despite their physical limitations. Last summer, a group of residents wanted to attend a Milwaukee Brewers game. Another resident, after suffering 3 strokes and hip replacement surgery, dreamed of sailing on Lake Mendota. Finally, she was able to feel the wind on her face while gliding across the open water. Another resident dreamed of attending a dance. After a lot of planning, the Care Center's social hall transformed to a dance hall, and members of our local ROTC escorted their dates to the dance. Enjoyed by so many, the dance is now an annual event. At the Care Center, it's never too late to live your dream.
The sisters have always taught us to go out and meet people where they are, not to wait for them to come and find us.
An early effort to reach out was an event called Baby's Day.
They opened the doors, and the doctors and staff here at St. Mary's and the sisters invited all the babies who had been born in the past year to come back for well baby exams.
Today, a partnership with nearby Lincoln School helps grade school kids stay healthy. The annual Happy Heart Fun Run to the hospital encourages fitness. The partnership also teaches kids about healthcare careers and creatively improves their future and the community we share.
We work to reach out to people, not wait till they get sick. We have our parish nurse program, which puts nurses out in many parishes in the area and helps deal with chronic illness and health needs.
St. Mary's sponsors 9 parish nurses in the local community, both rural and urban. And each one of our communities, Catholic, Lutheran, and Methodist, all have a very diverse population. So we offer programs that are specific to that church community. Parish nurses do a lot of home visits, and we feel that's very preventative. We can check their blood pressure, look over medications, look over their house and survey the scene for falls. The hospital can do a lot. We're very high-tech at the hospital. But when you can go into someone's house, you're on their terms, and you get to see how they actually live. They opened their doors to me and their homes and mostly their hearts. And so that's a really big responsibility that I carry with me, that I need to take care of them. They are part of my extended family now.
With the increasing challenges, philanthropy is again playing an increasing role in enabling us to do our best work and deliver exceptional care.
From the beginning, St. Mary's was built on our commitment to use resources wisely.
All these years, community serves the hospital serves the community.
Careful use of our resources fosters trust between St. Mary's and our many generous donors. This partnership enriches the care we give, enabling projects like the first in-hospital Ronald McDonald Family Room in Wisconsin, and supplying state-of-the-art Omnibed incubators for our tiniest patients.
It was emotional seeing the babies for the first time because it's your child and they should still be with you, but they're not. And so they're just little tiny bundles of tubes with very transparent skin. It's not typical that you would have one 25-weeker, let alone 4, go on to be healthy and normal. You know, that's a testament to our kids and that they're resilient and that they're fighters, but I think also it's a testament to the NICU at St. Mary's.
You know, there's no way that they would be here without the staff, without all the help they've had, and we have St. Mary's to thank.
A NICU is not someplace that you would ever want a child to have to be, but it saves lives. And the 4 kids that are sleeping in their beds right now are proof of that. And so to help out a facility like that, in essence, you are saving someone's son or daughter.
Physician partnerships are central to the story of St. Mary's, starting with Dr. Joe Dean, founder of the Dean Clinic.
He saw a place where physicians could practice, where they could really provide very good care to the patients in a way that they had not been able to do before.
This early collaboration leaves us leading the way in today's healthcare landscape.
The Dean-St. Mary's relationship puts us in a position which has been recognized nationally as one of the 30 or 40 most efficient healthcare delivery communities in the country.
There's always been a common set of values, a focus on excellence, a desire to be different and to be better that has been the tie that binds between Dean and St. Mary's. Dr. Dean and the sisters focused on being exceptional all those years ago, and I think they'd be very proud of what we've delivered.
Delivering exceptional life-saving care requires implementing the latest technology.
This is called a hybrid room. It combines the capabilities of a full cardiovascular operating room with the full imaging capabilities for a non-invasive imaging room. So it allows you to do both open procedures and less invasive heart and vascular procedures. It used to be that surgery and the percutaneous less invasive procedures were sort of, it was either one or the other, the surgeons and the cardiologists. And now it allows us to work together and to do procedures that we could never do before. We would have never guessed years ago that we'd be putting in valves through a small hole in the artery at the top of the leg. A room like this allows you to do these less invasive procedures, which greatly benefit our patients.
Our efforts are all about saving and changing lives.
I was walking back to my car with my granddaughter, and I was spinning. Everything was spinning around, so I decided to sit down. My granddaughter said that I just collapsed. My heart just stopped. My doctor told me that 20 years ago, I wouldn't be here today. Every day they come up with new technology to save lives and make it better for everybody.
As we meet the challenges of the future, we are inspired by our values, and we draw upon our extraordinary history of caring.
People are drawn here because they want to serve. They're drawn here because they want to be exceptional. They're drawn here because they're passionate about what they do and they want to be the best at it. And we know that we have to be better tomorrow than we were today. And that's the wonderful history that goes back to our founding in 1912. That started from modest circumstances, started after others said it couldn't be done. Here we are, over 100 years later, and we understand that we're not done yet.